Hi everyone. In this video, we're going to cover all the most important things you need to know about taking the medicine called Escitalopram, also known as Lexapro. We're going to cover side effects, who can't take the medicine, how it works, what it's used for, dosing, how long it takes to start working, what to monitor while taking it, and some special considerations I think are important to know. My name is Mattias Hartmann. I'm a physician associate, board certified in psychiatry, and I work full-time in psychiatry. I make these videos for everyday people like yourself who want to better understand depression treatments, and medications a bit better. First, we'll start off with common side effects. So the most common side effect is headaches at 24%, followed by nausea, 15 to 18%, insomnia, so trouble sleeping, at 7 to 14%, diarrhea at 6 to 14%, and sleepiness at 4 to 13%. And here are some less common side effects at less than 10%. Dry mouth, 4 to 9%, sweating too much, 3 to 8%, feeling tired, 2 to 8%, low sex drive at 3 to 7%. Now, these numbers are, as it shows there, from Up to Date. Up to Date gets these numbers from the packet insert. So the FDA-approved packet insert that these numbers were obtained from are from the trials that were used to get it FDA approved. Sexual dysfunction is a lot higher than 3 to 7% for Lexapro or any of the serotonin reuptake inhibitors like Prozac, sertraline, fluvoxamine, all of those. It's a lot higher. It's probably closer to 40 to 60%. If you want to know more about sexual dysfunction, side effect with these medicines, be sure to check out my video on that on my channel. But let's continue here. So constipation, 3 to 6%. Difficulty with orgasm, again, that's a sexual dysfunction side effect. It's a lot higher than 2 to 6%. Reflux, 2 to 6%. Decreased appetite, 3%. Erectile dysfunction, that's another sexual side effect. And strange dreams at 3%. Next, let's go over some dangerous but rare side effects. Seizures, low sodium. This is mostly in people that are elderly, over 65 years old. Mania. Lexapro does not cause mania. It can cause someone who already has bipolar disorder, who already has the genes that will eventually have them show signs of bipolar disorder, which is what mania is. But Lexapro doesn't cause people to have bipolar disorder, if that makes sense. It may just bring out mania in someone who was going to have bipolar disorder anyway. And suicidal thoughts. So suicidal thoughts can happen. It's rare. Happens in about 1% of people, specifically in people under 25 years old. So younger people, it seems to happen sometimes. I also have a video on this topic on my channel. If you're more interested in that, be sure to check out that video where I go a lot more in depth into the suicidal thoughts side effects. So who shouldn't be taking Lexapro? In whom is it contraindicated? Well, if you're taking a monoamine oxidase inhibitor, also known as an MAOI, if you're taking Pimozide, or if you have an allergy to Lexapro, of course. So how does Lexapro work for depression? Well, it works as a selective serotonin reuptake inhibitor. That's its only mechanism. And how Lexapro was made is actually, was made from Celexa. So Celexa came first, also known as citalopram, and Escitalopram, also known as Lexapro, is one part of Celexa, the left part specifically. So Celexa is both the right and left part. Lexapro is just the left part. So what is Lexapro used for? Well, it's used for a lot of things. First of all, let's go over the FDA-approved indications. Major depressive disorder in people that are 12 years and older, and is also FDA-approved for generalized anxiety disorder in people that are 7 years or older. It's used for a lot of other things other than just its FDA approvals. It's used for panic disorder. It's used for OCD, PTSD, social phobia, social anxiety disorder, same thing. Separation anxiety disorder, in PMDD, premenstrual dysphoric disorder. It's not only used for these, there's many other indications, but the main uses that one can think of are it's used for depression, and it's used for anxiety disorders. OCD kind of falls under that as well. And in trauma disorders, so PTSD as well. So how is Lexapro dosed for depression? Well, the starting dose is 10 milligrams daily. The usual dose range where people need to be to notice improvement in depression is about 10 to 20 milligrams daily. And 20 milligrams is also the max dose. The max dose specifically for depression, also known as major depressive disorder, also known as unipolar depression, and is also the max dose for generalized anxiety and many other conditions as well. However, OCD is the exception. For OCD, the doses are actually much higher. The usual dose range is actually 20 to 40 milligrams for OCD, which is super high. And one can even go beyond that into super therapeutic dose ranges. And the max would then for OCD would be 60 milligrams daily, but you do need to be more careful there when you're going up to those higher dose ranges. You got to look for QTc prolongation, which is a electrical heart condition that one checks with a electrocardiogram. EKG. So how long does it take for Lexapro to start working for depression? 2 to 4 weeks, like most antidepressants, most SSRIs, most SNRIs. This is the same, takes about 2 to 4 weeks, but it might take up to 6 to 8 weeks to notice the improvements or the full improvements. Of note, if we're talking about OCD again, which again, here we're primarily talking about depression, but for OCD, it does take a bit longer even to notice those full effects, sometimes up to 3 months. So is there anything one needs to monitor while taking Lexapro? No, not really. Nothing if you are healthy. And what are the special considerations when taking Lexapro? Well, it has a liquid formulation, so that's pretty cool. So if you can't swallow, that's great. That's there for you. It is generally considered safe in pregnancy. So is Zoloft, also known as sertraline. Those are the two generally preferred if there's a pregnancy. If you can take one of those, it's usually optimal. It doesn't interact with many medicines. It's metabolized in the liver, and it just doesn't interact with many of those liver enzymes, so it's usually safe to take with many other medicines. It's been around for a while. It's cheap. It's generic, so it's accessible, which is great. I found this interesting, so I added this here. It seems like SSRIs might not work as well in women over 50 years old, especially if they are not taking estrogen, and it might be helpful to supplement with estrogen and an SSRI in this specific population. If you like this video, be sure to check out this video on screen next where I go over Zoloft, also known as sertraline. It's also one of the first-line medicines used for depression, and I go over all the most important things you need to know. I'll see you over there.